Gracias. As you've probably been looking at the program, you've probably noticed that there are two similar last names from the United States. About a year ago, actually Dr. Silva, we were talking about diversity and inclusion at the last LAPS meeting in Mexico City, and it was very touching. Shortly after that meeting, my son Eric I was asked if my son Eric would speak. My son Eric is a member of the LGBTQ community, and I think he has a very powerful message. This is his first lecture, so he's a little bit nervous. So Eric, he's a college student in Kansas City, Missouri, and I think he has a message. And Eric, please come to the stage. And I kind of give him a few pointers, but as a father, I'm just very, very proud of him being here to be able to share with you some of his experience within medical care. Eric?
Bravo! Woo!
Hello. Pardon my anxiousness. Like my father said, this is my first lecture, especially in such an important conference. So, sorry. Again, apologies. So, a quick little snippet of who I am. So, like my father said, I am part of the LGBTQ community. I am a transgender man. So, I transitioned from my biological gender or sex is female. So in 2020, I began my medical transition. So I started testosterone. I've been on it for about 5 years now. I socially transitioned I think the end of my sophomore year of high school, so I'm 16 years old. I've been a member of the queer community since as long as I can remember. I knew that I liked a little bit more than just boys at a pretty young age. I am 23 years old. Like my father said, I am a college student in Kansas City, Missouri. I plan on attending the University of Kansas when I'm done with my basics at a community college. I plan on pursuing a degree in clinical laboratory science. I've always been interested in medicine. I mean, I have him for a dad, so that's no question. But my purpose here today is to talk about not only my experience receiving care as not only a queer person, but as a trans person. I want to preface and say that I do understand that sometimes as a medical professional, providing care for trans people, if you have provided care for trans people, can be difficult. I personally don't really have a lot of difficulty because I grew up in a family where healthcare was very front and central. So I'm fairly comfortable with people asking me questions, asking me, when did this happen? How did it happen? Can I touch here? Can I touch there? But unfortunately, a lot of the population of transgender people have a massive fear of even going to a general practitioner. And that is specifically not because of you as an individual, but as the amount of persecution that we as a community receive. I can't tell you how much as a U.S. citizen that our community has been in not only politics, but in a myriad of different things, news articles, politics, even just education. I mean, an example of that is just what happened in, I believe there was unfortunately, a school shooting at a Catholic school in the U.S., and the perpetrator happened to be someone that they identified as transgender. And because of that, our government is attempting to take away our right to bear arms, only because a very small statistic happened. And because of that, my community just doesn't even want to go outside. I mean, I fear for my life every time I just go into the city because I don't know if I'm going to be attacked, if I'm going to be approached. But back to just, speaking in medical terms, we don't hate you. We're scared. I am reminded of an experience that my father told me, that he had a transgender patient who came in for, I assume, pain, and they wouldn't let him touch him because they were scared. And unfortunately, the top reason of that fear is the high percentage of transgender people who are sexually assaulted. Unfortunately, the population as a whole of transgender people that are assaulted is 47%. It's very high. And splitting the two genders apart, you look at 37% of trans feminine people who are assaulted, and then you have 50% of trans masculine people who are assaulted. We are afraid of anyone getting physical with us because of that statistic. It's awful, and I really hate to say it, I'm part of that statistic myself. I mean, there are moments where I go to the doctor and I'm like, I don't know this person, I don't know if they know that I was born a girl and I'm a boy now. Are they going to have a bias against me? Are they even going to treat me? Which is something that does happen. There are medical professionals, there are doctors, there are nurse practitioners, there are even just medical assistants who hold a bias against us just because of our identity. And sometimes that can even result in malpractice cases. I have seen many examples of trans male people who go in to get top surgery, which is a double mastectomy in some cases. And the doctor won't even go through completely with the procedure and leave extra tissue in, quote, just in case they change their mind. The percentage of transgender people that regret gender affirming care is lower than the regret rate of people who receive tattoos. We don't go through these procedures because we just decided one day, oh, I don't want to have a chest anymore. We do it out of necessity because we don't feel comfortable in who we are and who we were born as. The rate of transgender individuals, not even just transgender individuals, but queer individuals that commit suicide is extremely high. I believe it is over 60%. I mean, I suffer from depression, I suffer from anxiety, I suffer from so many things, and I'm just one of the lucky few who has received good care. My transition journey was very smooth. I was able to receive care without really having to fight anybody. I received the right kind of care. I received my medication without difficulty. But there are people out there who struggle even getting in to see a physician. An example of that is my life partner, my fiance. He transitioned a lot earlier than I did. When he was a minor, I believe he started his journey when he was 16 years old. And he went through hell trying to get on just testosterone. He started he went through a program at the, I believe, Children's Mercy Hospital in Kansas City, Missouri. They have a program called Gender Pathways. And it's rare for a hospital to have such a program, especially in the Midwest. But he had to go through so much. He had to go through not only getting his parents' permission, both parents, mind you, but but he had to go through a year of therapy, psychotherapy. He had to go through multiple 4-hour sessions asking him constantly, are you sure? Are you sure? Are you sure? Not only that, but I mean, this man has known that he wanted to be a boy since he was 10 years old. And the struggle of just even being considered for it, I mean, they even considered not putting him on testosterone until he wasn't a minor. So he started when he was 16. They wanted to wait till he was 18 just to receive that kind of care. I'm reminded of when I was pre-transition, the amount of sadness, the amount of how uncomfortable I was before I started my medical transition. I honestly just wanted to crawl out of my own skin. It's feeling foreign to your own body. Gender affirming care is not something that should be even thought about in the care of anyone. It's necessary, absolutely necessary, regardless of the bias of the provider. Not only that, but unfortunately, specifically in transgender individuals, the percentage of transgender individuals that have chronic pain is higher than the percentage of our cisgender counterparts. So, I personally don't know if you've ever treated transgender individuals, but you most likely will at some point. We deal with pain a lot. I mean, I personally haven't dealt with chronic pain, but I have a friend who he is 21 years old and he has multiple sclerosis. He deals with excruciating pain on the daily. But because of this fear of persecution, he won't even go to a clinic. He won't even go to the ER. The first time that he went to the ER was a couple of weeks ago, and he hadn't been to one ever, even when he was in pain so bad that he couldn't stand. We're scared. We're scared for even existing. There are a large population of us who won't even transition and force ourselves into a position where we will feel uncomfortable for the rest of our lives because we are fearful of persecution. It makes me sad that we have to deal with that. I think it's hateful that there are people out there, not only people but physicians, who see us as less than human because we are who we are, that we are some sort of mistake, that we are an anomaly. I know that in retrospect, we are a very small population. In the United States, transgender people make up about only 1%. But if you look at that objectively, that's 1.6 million people. That's a pretty large population. That's more than you think it is. We are not an anomaly. We are not a problem. We are just as human as people who aren't transgender or even queer. We deserve the same level of care as our cisgender counterparts. We even just deserve the same amount of attention as others. But because of bias and because of hate, we're looked at as a problem. And I just want to say that even being here, being offered the chance to speak, speaks louder more than you think it does. It is rare for someone like myself, who isn't a big name in anything. I mean, I celebrities who are transgender do. I do this because I want to advocate for my community. I want to teach people like you who are interested in people like me how to treat us. Because we want to be treated as scared as we are. And again, I want to thank you for giving me this opportunity. Thank you so much.
Bravo.
This week, I haven't had a lot of time to spend time with my son, just one-on-one. And so, over the last few days, I think I've learned a lot from Eric. You know, as a parent, it's an adjustment as well. And I love you. From the bottom of my heart. Very, very proud of you for coming up here. You're a pretty polished speaker. I think it was about 5 times. In my first lecture, there was probably 100. But thank you again for telling us your journey. I do appreciate that, and I'm sure everybody else appreciates it as well. So, thank you.
Thank you, Eric, for being so brave. We need more brave people. Tengo el honor ahora de presentar a la